Hi, I'm Dr. Reshma Rakshit, consultant gastroenterologist. Today, I want to talk to you about irritable bowel syndrome, or IBS in short. It's a very common condition, and you must have heard about it around. 1 in 10 people in the UK suffer from it. We still don't know what causes irritable bowel syndrome, but today I'm hoping to tell you a little bit more about it so you can understand, self-manage, and see a doctor when you need to. Irritable bowel syndrome is a combination of change in bowel habit along with pain in the abdomen or the tummy area. There are many types of irritable bowel syndrome. The commonest is called post-infectious IBS. About 20% of patients who have gastroenteritis or food poisoning develop this condition. And I see a lot of patients over the summer months and after barbecues. There are 3 categories of irritable bowel syndrome. About a third of patients have diarrhea predominant, where people have loose bowel movements. A third of patients have constipation predominant, where actually they have difficulty in passing stools. And a third of patients have mixed functions. When you develop these symptoms and you see a doctor or a GP, they would want to do certain tests. Irritable bowel syndrome is diagnosed via your symptoms, and the tests are done to exclude other conditions. So a GP might do blood tests to exclude celiac disease or anemia, which is a low blood count. They might also send you for a stool test to look for inflammation in your bowel. The normal function of the bowel is to move food along and waste along, and it does it by causing peristalsis, which is movement or spasm of the bowel. In a normal situation, most of us can't feel it. However, in certain individuals who are more sensitive or whose bowels are more sensitive, they might be able to feel this. And this causes the pain of irritable bowel syndrome. Other symptoms you might commonly feel include bloating or distension of the tummy or a feeling of urgency to go to the toilet. Often patients with irritable bowel syndrome will report that once they've been to the toilet and they've evacuated, their symptoms get better. What are the risk factors for irritable bowel syndrome? Well, we really don't know it very well, and a lot of research is going into this. There are some new studies suggesting genetics might be involved, although no real genetic tests are being done as of now. However, 2 main common problems or risk factors include environmental issues. First, diet, and second, stress. Irritable bowel syndrome is now classified as a gut-brain axis dysfunction, which means 2 organs are involved, your digestive tract and your brain. And therefore, focus needs to be given to both of these to treat it well. However, if you develop some of what we call red flag signs or worrying symptoms, these need to be investigated urgently. So, if you develop bleeding from your back passage, unintentional weight loss, or you have a strong family history of bowel cancer, these need to be checked. Treatment of irritable bowel syndrome is not easy because it's a multifactorial condition, which means many things may trigger one person. Treatment needs to be based on modifying these trigger factors. I often ask patients to go through their symptoms in detail, and then we talk about their lifestyle. This is a key area where self-help often helps. Keeping a food diary to identify your own food triggers would be useful. Common triggers include excess alcohol, eating spicy or heavy meals, irregular meal times, and certain foods we call FODMAPs, and I'll explain this later. The second thing would be to have regular meal times, avoid eating late at night. And this might sound strange, but feeling happy during meals. The second thing we can do is to look at your diet in detail, and I refer patients to dietitians. There is a specific exclusion diet called the low FODMAP diet, which the dietitian can work with you. And these include excluding starches called FODMAPs, which our gut can't digest, and they cause fermentation and bloating of the tummy and diarrhea. Excluding these foods for a short period of time and then reintroducing foods are the best way to find out what your triggers are. The second thing I talked about is stress, and this is easier said than done. Often looking into your own lifestyle and identifying stress factors and trying to work on these either by yourself or with a psychologist or a counselor would be really helpful. There are lots of studies to show acupuncture, gut-directed hypnotherapy, and CBT, which is cognitive behavioral therapy, really work in IBS. Although irritable bowel syndrome is a common condition, often patients get told that it's in their head. It really isn't. It's a physical problem which needs proper education and treatment. So come and see me, and I hope to be able to help you with this. Thank you.